Hello and welcome. This is Rethinking Rural Health Financing on What About Rural Health? You are listening to the podcast that asks the question too many people forget. What about rural health? I am your host, Chinasa Imo. Together, we are uncovering the stories, challenges, and innovations shaping healthcare in overlooked communities. In this series, we ask hard questions about how money moves, who gets funding, who gets saved, who gets served, and who gets excluded. From policy to practice, we explore what healthcare financing should look like for everyone. I think I want to and not to cut you short, but I want to agree with you because you would know on sidetrack that I do also run a nonprofit, and we started these microcredit issues because zero interest microcredit initiative, and in communities where and I make this argument a lot, and I learned this during my master's program at UU Chicago. I was taking a course on global health, and we had a topic on global health financing. And American system doesn't see health as a human right. So coming from a perspective where health is a human right for me as a Nigerian, and sitting in this class, and I stood up and say, health is a human right. Everyone, irrespective of who they are, where they live, their color, their language, and their capacity, should be able to have basic, quality, equitable health care. Do you know what the professor asked me? Who will pay for it? So that question up until today, I still boggle my mind around that. Who will pay for the health system, right? And he went on to analyze that the cost of one medical doctor to the ratio of how many people a medical doctor could see a day, plus allied staff. In total, this is what it costs. So when you say that people should have free medical care, and then he turned around and said, does it make you wonder why you would not have quality healthcare service in the place you are advocating for free healthcare? Because if a medical doctor costs this amount of money, that means that the communities you are advocating for will most likely not afford to have this medical doctor in their community, because it wouldn't be a viable professional environment for this medical doctor. Now, what that leads me to now think about is, when we talk about health financing, is yes, there is the onus that lies on government to fund health, and there are initiatives of different funding organizations to fund research, R&D. And those are not the things that beneficiaries are going to fund. So there's supposed to be a pool of a lot of funding, but the person who is receiving care at the point of care should be able to access health. And how would they do that? It's only when they are financially capacitated. And if a woman, like you had empowered them, have a 500K to start up a business and is able to grow that business, there is every possibility that a fraction of that money you've given her would allow that woman to take her sick child to a better hospital because she can afford to pay for the hospital bill. But let's take a quick break, and when we come back, we would continue this conversation. To our listeners, as you listen to this conversation, I want you to reflect and feel free to leave your comment or opinion in the comment section. What are the psychosocial needs in your own community that go unmet because health systems are underfunded, absent, or disconnected from your community reach? And thinking about community psychology, where do you see opportunity, whether big or small, for communities to organize, heal, and advocate for their own health and dignity, even when formal support is limited? Welcome back. So let's bring back the attention to you, Moshood. When we hear the phrase reconnecting to the source, what should our listener bear in mind, especially when we think about rural communities? We've been talking about the global south perspective since we started. So when we think about rural communities in that lens, what should reconnecting to the source mean to our listeners?
So source now is it used to be very specific, right? But I think there's a saying now that wherever you find yourself is where you make home,
Yeah.
right? So source is kind of multi process now. That's me kind of being a professor here. If I'm very, very original, um, source is one. Source of life, source of, energy, source of all of that. Is one. As a matter of God, as a matter of course, whether you're a Muslim, whether you're a Christian, we there's a belief, whether you're a traditionalist, another religion across the world, there's a belief system in all of these religions that we're all just trying to find our way back home to that one source, which is, enlightenment, which is, some people call it God, some people call it, different name. But the idea is that we're all kind of trying to find our way back to that source.
I'll call it identity.
Yeah, well, people call it, that's why I say people call it dependent.
Yeah.
That's the jump start, right? If we honor that, if we know that's the ideal, so it means like there's nowhere where you cannot sort of plug into the source. The idea of source for the rural, for even for urban community, is so much complicated now, because I think people are so carried away with what we have now that people are not thinking about plugging back to the source. It's not the yogas that we do. Like the yogas that you see we do here in the West, it's not that. That's not plugging in. You're doing yoga, you have your ear plugged, and you listen to Mariah Carey. That is romanticizing your head, and you're traveling, thinking about sex and all of that. There's no way you can do it if truly you need to do that. So when the idea of running for the conference came up, if you've seen the website, if you've seen the proposal, I wrote all of that while I was checking in with people like Dr. Because Dr. was working with me closely. I was checking with Dr. Reda. I was checking with Dr. Tiffany Jimenez, just so you can see what I was writing with connecting to the source. Some people make a case for, you said reconnecting to the source and something about motherland. Some people said don't use motherland because the way we describe motherland in the context of Africa, motherland is not for everyone. As a matter of fact, people come over there and poo-poo on, what we've described as motherland. But I think in there too, there's a misgiving because motherland, by what I was thinking, is for everyone. By me saying now that you can tap into it anywhere you are. So, in a very nutshell, reconnecting to the source now is we have AI. And I think people said AI is making the separation between you, we call it Ori, your chakra, your essence, is separating it because you do not have space to be with what that identity that you call it is. I tend to disagree, right? They're all prototype of that is one. All of this AI, all of this technology that we're using, right? We can describe it if we're going to go to ontology from where, or cosmology actually from where we are. So we have the Ogun as the owner of the technology. We have the Oya for rain and all of that. The way we hold it is different, right? This will not be a problem for me. It could be the source. I'm talking about when I say this, I'm talking about technology. This will actually aid me in my work to center me, to put me grounded, to be able to do what I need to do. Because what? They're part of that source too, right? I've identified that there's no me without them, there's no them without me. So it's easy for me to use them accordingly like that. Now, there's no one way, there's no two way, there's no multiple way. Or there is multiple way to get into the source. And I think it's the concept of how you are, who you are, where you are. And I think that's what the world is trying to take away from a lot of us. So we get carried away. You and I are fighting each other for absolutely no reason. When you think about it very well, it's politics. And when we think about it, let's from the context of where you come from, in Nigeria specifically, you will not belong to the what? I will belong to the Yoruba folks, west of Nigeria, right? You will belong to
The Igbo tribe.
the Igbo tribe, the East. When it comes down to politics, we are fighting, you know. But in the long run, with the work that I do here, I've seen Eritrean community and Ethiopian community live side by side, and they're killing each other back home. They're worshiping the same entity, whether they call it God or not, but they're fighting there. But here, their partner. Pakistani community in the US and India. You even see stores that say India Pakistani store.
Yes, I've seen a couple of that here in Chicago.
But just recently there was bombing
Mhm.
between these two nations, these two great nations that used to be one, right? That used to worship the same essence, that used to be the same thing, but because of where we are with politics, then they don't see themselves as one. So I think that's what we're thinking. That's a lot of what informed my querying. Let's return to the source. And I'm not questioning us to go back to something, because that's not the point, because that's what people hear when they hear go back to the source.
But ideologically, for us to identify who we are within all of these things
Within all of this thing.
and know that, I think I hear you, and it now makes sense to me with regards to connecting to the source. And um it seems like there's been a lot of noise in between. Um it, the want of good living sometimes and the pursuit for greener pastures sometimes can make us forget the essence. And this is me philosophizing on my own part. Make us lose the essence of who we are as a human being.
We don't lose it.
I mean, we lose track.
We join it, yes.
Yeah, we lose track of who we are as human being and begin to see ourselves quite different without actually knowing that at the essence, using your word, we are still one human being. And if only we could connect back to that singular important truth, then we can begin to figure out what is it that makes us unique, right? Sometimes different is not bad, different is unique. And how do we tap into that uniqueness and build a collective force instead of now making that uniqueness the thing that is dividing us? That is so. I mean, this is me and you. This is you lecturing, and this is me understanding as a student.
I read an analysis post 30 December that just passed.
Mhm.
Lagos State by itself, welcome I think they said 500,000 international planes.
Wow.
Lagos just by itself. Lagos had a 1.9 billion.
To the idea.
Just Lagos, right? We're not talking about people that went to Onisha, people that went to Anambra, all of that. Just Lagos. Now, when people get to this, when they leave and when they get to these places, because it's even the name says dirty December, people forget everything. I mean, it's simple when you think about soccer, for instance.
Yeah.
Football.
Yeah.
Football is the only thing that plug us back into those kind of enlightenment, into that kind of source that we're talking about in Nigeria, particular. No, across the world.
Across the world.
Because I've seen boys talk about Jersey, just Jersey, like you don't know me, I'm not you, and we've lost that because of this education that we're all pursuing. But people still plug into. They easily go back without any therapeutical any therapy. They go easily back into this source of becoming that one when they're talking about this unifier.
Mhm.
When people are fighting over money, if you don't end up killing themselves, it's a plug back into this source. When husband and wife are loving, when there's that harmony in the house, you see clarity of that plugging in easily. When your children are doing right, easily you can see the possession that come over everybody. The husband want to protect the wife and the children. The wife want to protect the home. Because there's that harmony, that little plug-in at that time. And sometimes we ride with it for a month. Sometimes we lose touch of it. There's nothing wrong with this. What I said, for us doing community psychology, the difference is part. There's a different phrase that we use, framework, is called crack.
Mm.
When you can see through the crack, you will know that there are monsters living in the crack. This is bios. There's a philosopher called Bayo Akomolape that says that whatever give you the privilege to look into the crack, you'll be surprised what you find.
Yeah.
Now, how can you romance what you find in the crack? Because they will keep coming. They are part of the ecology or cosmological system. Just understand them. So the healthcare system was designed by us for us.
Yeah.
How can it then be a failure that we refuse to get to where we need to get to with it? That's something we need to analyze.
Thanks for that response. And now that you mentioned healthcare system, let's go back to the health system. So, oftentimes when we mention health, and I think you would have heard it from me a couple of times, we talk about facilities a lot, we talk about services a lot. But from all that you are explaining to me here about community psychology, you are opening my eyes, and I believe the eyes of my audience as well, to actually pivot and think about people, power and power dynamics, and the relationship that can be built within that, and where, in terms of place and locations where those relationships are happening. So, why do you think that these things matter, especially when we talk about rural health?
So power and people, right?
Power, people, relationship, and place.
Mm-hmm. Community psychologists do study. There's a lot of people. There's a lot of colleagues of mine actually too that are studying relationality.
Mhm.
Because in relationality there's the power process, there's the history, and I did talk about it in the beginning. Um, um, and power. There's power over. There's power with. They all take different shape and forms when you think about it. You know. Uh, to stretch it out. So a refugee family will now come here, right? They don't speak a word of English. But when their son gets here, their son that is 14 years old, he begins to quickly pick up. So he's working. The configuration of where they're coming from is that the father is the head of the household, right?
Yeah.
And they have to all know that. But because this boy is speaking, so anything that the family needs to do, he's the interpreter. He's the one doing everything. Expose him to become the head of the household in this part of the world. The shift breaks the family. And the father, the mother, even the system that is supposed to support them does not understand that dynamic. That this boy is being put in a place where the father is honored. But that makes the father sick. That I'm using sick as the word that comes to my mind. Without interrogating those kind of power structure. And that's just one of many. Without interrogating and saying, and try to develop an intervention that help the father understand why this is it.
Yeah.
The father is lost.
Mm-hmm.
So is the mother. So is the son. Though the son can be well because, to him now he's making money, he's supporting, but the structure that we know to be is lost, it's left to roam. But how do we now then design to analyze this power, right? How do we design to understand that people have structure where they're coming from? America is a melting pot. So everybody is coming here trying to kind of Americanize. And it's not all Americanization that works. Because a lot of time what I just explained now has destroyed so many families.
Yeah.
Right? Some people have used sex, for instance, as the only transaction to get here during migration. So you see women, the only thing they have is to, use sex. Some people have used their organ. So what it means is like they have to live on lifetime of dialysis. Do we even know to analyze this intersection of these people and how we need to bring them to the public health that this new environment need to support? Because remember, the rural health is being built for specific people, by
Yeah.
specific people. The politicians that have built this understand it for the local people.
Mm.
The new influx of people that are coming into there, have we analyzed some of what I'm describing now? Because with that, even in the school system, when this kid go to the school, and this is not just talking about just migrants, this happened to even people, families here. There are people from a broken home, there are, husband and wife that their kid have to now take care of themselves. There are people that are struggling to to make end meet. They all belong to this power system that we need to analyze. Without this analysis, I think no matter what we build, we're building. There's a way we say it in back on where you build a foundation on a rocky,
on a sandy ground.
How is it going to stand?
Yeah.
And that's the problem. Just think about the boy that I just gave you his analysis. Like, no matter what you do, no matter how you do, you have to be careful because that boy will probably be traumatized for the rest of his life. If the father keep rejecting, it will never make meaning until we analyze it this way and kind of spell it out. These little details, as little as they are, that's where the power lies in. And talk about the elites, the people that make policy. You realize that some of them, because we meet with them, we've worked with some of them, and they don't know jack. And this is not blaming anybody because people pay attention to what they need to pay attention to.
Yeah.
But oftentimes when we get into this place, because of the power they have, when they say some of what they're saying, you be like, oh my Lord, how did this person get here? It's not their fault. We understand it for this, like people are different, people's need is different. That's why we know that because of our analysis of people, history, and places. But the politicians here, why should they so much care about that I'm just talking about? Because to them is the next thing is the next 4 years of election. So until we know this little detail and how to analyze and how to plug them into the policy, I think they said all policy. There's a way they say that I'm missing out something about all policy. Is the same way you describe health is human rights. The same way they describe policy, like all policies, something about all policy is policy or something like that. I'll send that to you if I get it. But that no matter the policy you do, it has to be all inclusive. But we don't do that.
Yeah, yeah. I mean, I agree with you, and I've had a saying, a different kind of saying that the policy of today is addressing the consequences of the policy of yesterday. So, so policies are built on top of each other because sometimes we make policies and we don't know the implication of it. And I understand you from the part of a policy maker who doesn't know jack about community and rural environment, right? And I will not blame them because everybody did not grow in the rural area, right? Most people all their life has been urban rich government politics position, right? However, I think this is where I throw back the question to you instead of trying to boggle it in my mind and come up with something. So knowing this fact that not too many people know what to do, and hearing this specific anecdote that you provided about the recalibration of family leadership based on, because typically an African man does not consider that money ascends you to leadership.
No.
And yes, typically, because we are patriarchally wired to just place the man as the head of the family. And that's one of the biggest problems sometimes that men and women quarrel because then the woman is earning more money. Let's say it's not the boy in this case, but the woman is earning more money because probably the degree she acquired has exposed her to opportunities, and that calibrates family leadership because the entry of the economic power has in some way shifted who is leading decision making within the family. So hearing all of this and putting this side by side with the policymakers and the people themselves, what kind of problem would community psychologists now help us avert without getting to the point where we need to build an intervention?
We always have to build an intervention.
Okay.
There's never going to be too much intervention. We always have to build it. Again, very strategically, I think is the people, right? If we can harness the people, all of the richness, resources within the people, because believe me, there's certain area on the south side is not, so we shouldn't use south side or north side as rural. The blue is Blue Island is called for folks that I understand Chicagoland
Like,
regional context. If you travel out of state, out of central Chicago a little bit, you start seeing different communities. Those are very, very rural. But guess who is revitalizing these communities? Just guess. Take a wild guess. It's us. It's the migrant. It's the immigrant. It's the African folks that come because the overburden of the system in the urban jungle that we have here forces them to go. Guess what they do when they get over there? They open businesses, even if it's among themselves. But in less than 2 years, and then their cousins and nephew will follow them. And so if you had time, please drive. Take a drive to this Blue Island. There's a lot of them that I'm not remembering now, but the way they've developed this area in less than 3 years, 4 years. In fact, actually, I want to analyze that. I actually want to research and go to this community and sit with them and say, what do you guys do right? Because the school systems there were crumbling. But once they get there, you people that don't know jack about talking to the government people will now find a way to get to the other men and say, oh, we can help you with this, we can do this. And these areas are vitalized. So Chicago lost or is losing now. I think as the last time I remember was about Chicago has lost about 40% of people to these different intercity that is surrounding the central Illinois, Chicago, because people find substance in those rural community. If they farm, it doesn't even have to be their land. If they farm, they eating fresh produce that they are making, producing by themselves. So without creating any sort of new intervention, people are the resources. People are the intervention themselves. People know what to do. What we need to do, you and I and the rest of the people that have the access and power, is to give the people what people need to use as tools.
I agree. I agree with you.
I promise you, give people the tools they need, aid them in how they can become empowered. One of the things we study the most in CP, community psychology, is, so we have where we troubleshoot with individual empowerment, organizational empowerment, societal empowerment. Each of these different things I'm listing means different things. And none of them proceed. So if somebody does not have individual empowerment, you can't expect them to have organizational empowerment. Like if they don't believe in themselves that they can do it, if psychologically something is missing, you cannot expect them to be societally empowered to contribute. So let's start with individual empowerment. Give people access to what they need, and you'll be surprised how much you get out of people.
So it boils down to empowerment of individual self, empowerment of society as well, for us to shift this
Organizational,
an organizational
psychological empowerment. All of these are product of let me paint you something. And I know we're running out of time on something like that. I teach a course called Social Determinant of Mental Health. So the criteria for social determinant is things that are not generic disposed. Like, so it's not the what is it called? Cancer. It's not all of those, what am I missing out of it now? All of those sickness that are not societally generated. We also find out that some of those too, like some of them now have societal influences to how they're developing. We'll come to that. But the idea is like societally generated problem, including poverty, including overemployment, including underemployment, including homelessness, right? They are societal, they are social, they are the determinant of mental health. Because, for instance, a woman will now leave her house. She's doing 2 jobs. And she's not married because, for whatever reason. So she has 2 kids. Johnny is 6. Sufi is 4. But she has to leave at 6 a.m. because she needs to make end meet. So she's doing 3 jobs. Whatever she's making does not help meet what she needs to, but she's doing it anyway. So when she leaves 6 a.m. and she tells this Johnny boy, like, wake up and take your sister, make sure you guys get to school. These kids don't wake up until like 10 o'clock. So they miss school almost every time that she go, and she come home and complain, but she still has to work, right? Where do you think the system needs to meet her in that sense? Because of course there's going to be many of her like that, right? Uh, if only the school can follow up with the kid. If only there's a counselor in school that can meet this kid every day to make sure they get to school. Why can't we do that?
Yeah, but we repurpose the blame back to the mother.
The mother that she's doing 3-4 work, and then if she doesn't do 3 work, she become homeless, and then we spend more money on homelessness, we go on shelter and all of that. But she's struggling now to make ends meet, and we don't meet her when she's doing that.
Yeah.
But when it becomes like she can't meet up anymore because she's now, because if you're doing 3 jobs, you're sick already. You have mental, that's why we mean social determinant of mental health.
Yeah.
You're already having some kind of mental breakdown. Your kids that are not going to school when they're supposed to go are also dealing with some kind of mental distress.
And they're not getting to see you, and you are the only parent taking
Those are
care
part
of
of, those are
them.
part of social.
So they have less social cognitive skills.
Obviously, because they can meet up with, when they meet with their folks is when you know that something is wrong with them.
Yeah.
I mean, they are kid folks. They hate drink because when you ask them to play, they're not used to it. You ask them to do Fortress or whatever these kids play these days, and then they'll be looking at them like, what is this? But you'll be wondering like, why? It's easy. Can they just do it? Because how would they do it? Even if they can do it, there's that way to express yourself that is not guaranteed because you don't do it every day.
Thank you so much.
So
Thank you so much. Let's go for a quick break, and then when we come back, we'll pivot and discuss the conference. Do you have a rural health story that needs to be heard? Whether you're a health worker, patient, policymaker, or advocate, we want to hear from you. Share your story on our website. Go to www.whataboutruralhealth.com/stories and help us amplify the realities behind the data. Someone from our team will contact you with details on how to get your story published on our newsletter, website, and other media platforms. Welcome back. You are listening to What About Rural Health with Chinasa Imo. So, Dr. Moshood, let's spend a little bit of time discussing the upcoming international conference. Tell us a little bit about it.
In my field of community psychology, this conference is like where we meet, people that are community psychologists, but it's beyond just community psychology because you're other allied professional. Come join us. But this is where we meet to talk about the new theories, the new concept that people are working on. It's biennial, like 2 years. And the last one was in Uruguay. So some of us bid for this one because we thought, because of the shift, the global south shift that we can all see, the browning of the world that we're all seeing, which is causing havoc around the world, because a lot of the problem we're having now is around that, like because there's the browning, and then the browning are becoming more professional. And I, if you don't know that phenomenon, please go and search for it. Like the world is becoming more brown in that sense. So, and with the direction that the world is going, that route, when I say that route to Africa, was a careful thinking. Like when we bid for this conference, we didn't know it was going to happen. So we bid for it. We won the host right because as much as community psychology across the world are developing concept, theory, framework, models, we also understand that a lot of the initial theory for this discipline is very, very Africa in orientation. So now when we get back there, we can intersect what we have, what we've been working with the new things that people are and what is happening on the continent. That's the whole idea in the beginning.
Thank you so much for explaining that. So, as the president of the committee now, why does hosting this conference in Nigeria matters for community psychology globally?
It matters. There's a couple of different areas that we can think of, and I know you're watching time, but let's brag. Right now, I'm president for Division 27. So this division is the one that is in charge of everything community psychologists across the world.
Okay.
Shouldn't be, but that's what we have right now. It's called Division 27 of American Psychological Association. APA is American Psychology. They have 54. They have 54 divisions. They have 54 divisions. So out of the 54, I'm leading the 27 division. What this means is that I'm in charge of the division to promote this community psychology. What a time to actually go and host it in our backyard. But what it means is like the emphasis that we are breathing into community psychology because of who we are, because of where we're coming from, actually needs to be on display too. Many of us hold this important, that's why I say let's brag. Many of us doing community psychology holds these important places, but we don't think of going back home. Because home, in a way, does not have what we think is going to help us do the work. But until we go, which is why we're showcasing this conference, we would not know what is available too. Some of us have left home for the longest time. Some of us heard different story about home. But until we go and kind of display this conference before the world, I think we're missing out.
I agree with you. I was at a conference in DC last week and I met someone and the person is like, "Are you gonna be in the community psychology conference that is happening in Nigeria?" When I introduce myself and say I'm Nigerian, I say, "Yes, I am going to be, and we are partner of this conference. So you would see me there." So thank you so much for the opportunity to bring us down there. But something that I'm going to ask you is how will this be meaningful to improving rural health?
Hmm. Yeah. Um, Very specifically, it will be because, I didn't get to it here, but I'm hoping to submit abstracts that look at some of the rural crisis in Nigeria as something that I want to actually talk about. So my intention is to bring like the chairman of local government,
Mm,
bring community leaders to these sections so they can talk about their problem,
mm,
and we bring partners to come to that section and give idea, not say you do it, but an idea of how to improve some of the crises they have in those local contests, which I think will be a blessing for them.
I would definitely want to be in that section.
So
So thank you so much for that response. But I want to ask you, um, if someone comes to this conference and leaves without changing how they think about community, what would you say is what's that big thing that they have missed?
I think it's impossible for them not to change.
Mm,
I think it's impossible with what I think we're doing, and if we have our way, I think it's impossible. If it doesn't, if it doesn't show up immediately, residually, it's going to show up later.
I like that response. I like how you put it.
No, because with everything, because if they don't see it, they will hear it. If they don't hear it, it will reverberate somewhere.
They will feel it.
So that's why we said gathering in the motherland to reconnect to the soil. Remember what I said?
Yeah.
This is the plugin. This is like the Bluetooth where you need to use to reset. So even if it doesn't show up immediately when you get back to your respective places, some way, somehow, with what your body have accumulated while you are there, it will show up in your writing, in your work, in your thinking. I'm 100% sure. I know that for a fact.
Thank you so much. So beyond these 4 days, because seriously, all of these ideas that you have about reconnecting and bringing back community psychologists from around the world to connect back to the source in Africa, it would not happen in 4 days. So beyond this, what would success look like for you post conference as the president?
So it's not just 4 day though. We have the pre-conference
Yeah,
to
that's
showcase Lagos. There's a lot of education in that. It's built around the water theme. There's the post-conference. It's built around showing the slave era crisis, and the place we're going for the post-conference actually has all of that history. So people will take those away. Uh, Success for me is that because right now we have less than what we expect in terms of abstract, in terms of success for me would be like enough people show up.
mm,
Uh, I'm guaranteeing that there's going to be takeaway. There's no doubt.
mhm.
But if people don't show up, if people are worried about the geopolitical crisis that's happening across the world and the one that we've seen in Nigeria, in the north part of Nigeria particularly, which is not reverberating in Lagos at all. If people don't show up, then it defeats the purpose. It defeats everything that we put on display that we want to show. But there's always a saying that even if it's only one person that show up, that one person will generate so much energy that they will see the spark. And then even if other people don't show up, the spark will show up for other people here later. I think that's the best way to say it. We're not worried. We're not going to force people. We're saying if you want to reconnect, it can't force you to reconnect. That's not the idea. You have to see the need for it.
Thank you
So
so
that's
much.
success for me too. Like
Yes.
people willingly take ownership of I have to go and see this for what it is.
Thank you so much for that. And I believe that the website iccplagos.com, you work your way through to submit abstract. Let us hear your perspective on how to improve community psychology practice around the world. Submit that abstract. So as we wrap up this conversation, all that you have been saying, I keep thinking about water, how it moves, how it adapts, and how it finds its way, even when the path is blocked. And I know you mentioned something about cracks in the system and all whatnot, and all of those things come to mind. And I see that that's what community psychology reminds us of, that health is not only built in clinics or budgets, but in the relationship, in collective care, and in the everyday ways that communities survive and heal. Now, in rural communities and underserved places, especially here in Southside Chicago and in global South countries as well, people are often asked to carry the weight of broken system. Yet, what we have heard today is that communities are not empty spaces that are waiting to be fixed. They are sources of knowledge. They do have resilience and they accumulate power. These are things that we need to pay attention to. And community psychologists play critical role here in the way that they partner, or they should, or they will partner with community to help surface these community strengths and prevent harm even before they happen. Promote well-being in ways that are culturally grounded and sustainable. So, people, as we move to this ICCP 2026 in Lagos, I hope that this conversation would invite you to think differently about what it means to gather, to listen deeply, to reconnect to the source, and to ensure that the knowledge we generate flow back to the communities that it is meant to serve. Moshood, seriously, I would love to end on this note, but I cannot wrap without asking you your final question. So, and I like to end on a good note. If you could leave a policymaker or health professional, someone to have a shift of mindset about rural community, what would that be?
Hmm. If I can sort of suggest to them, hmm,
Just one statement. What would you tell them to do to have a shift in mindset?
trust people. Trust.
That is powerful.
Trust.
That is powerful. So thank you so much, Moshood, for joining us in the studio today and for all of your thoughtful conversation and leadership as you continue to steer this conference. I am grateful for your time, your insight, and your commitment to communities around the world. And to everyone listening, thank you for joining us today at What About Rural Health. If this episode moved you, challenged you, or made you think a little differently, please follow, subscribe, and leave us a review on your favorite podcast platform. And as always, let us keep asking the question, what about rural health? Until next time, I am still your host, Chinasa Imo. Bye for now.